A lot of parents seem to have concerns around particularly the eyes, the ears, the nose, the mouth. What can you tell us about those?
Well, these are very, very common complaints in the office when parents come to us after a sleepless night. And so I want to go through these in a little bit more detail so that you as a parent know when to trigger that phone call. So let's start with the eyes first. I think vision for all of us is so key and so important. And when your child has a problem with their vision, or if they have a problem with the muscle strength of their eyes, these conditions sometimes are so subtle that they're often not seen in the office and they may be passed off by your healthcare provider. So your observations at home of your child's eye movements and how they seem to perceive picking up objects or see things from a distance are so, so important to report to your doctor. So if you see eyes turning in an alert child, and I'm saying that because sleepy kids often will have their eyes pop up in the back of their head, or they'll have droopy eyes, or one eye crosses in as they're about to fall off to sleep. That's not the situation I'm talking about. It's when your child is awake and alert and suddenly one eye seems to turn in, or both eyes turn in fairly frequently. Those are things to report to your doctor. Also, if you notice that the whites of the eyes are discolored a bit, if they look bluish or grayish or even have tinges of yellow, those are important to note because they typically should stay white, and if they do change colors, sometimes it points to genetic conditions or sometimes issues with the liver or with the pancreas. So very, very important as a parent. You live with your child 24/7. You really know what color they are to report that, and also photograph those changes if you can.
Okay.
Eyelashes. Now, we might not think that they're really important, but they are. They help protect the eyes against foreign bodies and dust. But some eyelashes grow in a little wonky, a little funky, and sometimes they'll grow in the reverse. They'll turn in and scratch the eye. That condition is called entropion, and it can be very uncomfortable for a child. It can scratch their corneas and lead to chronic rubbing and chronic injury of the eye. So if your child's eyelashes appear to be growing inward rather than outward, best to get to a pediatric ophthalmologist and get some advice on what to do. Similarly, a lot of children have the equivalent of cradle cap on their eyelid margins, and that is called marginal blepharitis. Sometimes it's from allergies, sometimes it's just from overactive oil glands, but what babies typically get and little toddlers get are crusty little yellow discharge that's right around the base of the lashes. Can be quite uncomfortable, and again, all that excessive rubbing can lead to sometimes potential injuries to the eyes. The other thing with little eyes that's so important is that if you as a parent look at your child and from the side all of a sudden their lens, which is basically their iris that's around their pupil, the colored part of the eye, if you see it look a little dull or kind of opaque, that's important to note and to tell your doctor immediately, because glaucoma and issues with eye pressure can show up in little ones. They can be signs of internal illness. They can occur on their own, and often a parent is the first one to note that there's a little bit of dullness to one eye, and it's so, so important to report. Now, the most common thing that we see with kids is that 90% of babies may have some partial or full obstruction or blockage of one or both of the tear ducts. And when that happens, these babies typically will have overwatering or over-tearing of one eye that's quite chronic. The good news is that 90% of these children outgrow the condition by the time they're a year of age, and another 5 to 6% will outgrow it by the time they're 2. But these little wet eyes are subject to a lot of rubbing. They're subject to some redness, to conjunctivitis or pink eye. And so if there is green or yellow discharge or just a lot of irritability in your child who has a blocked tear duct, it's important to speak with your doctor about that. And lastly, I think the key thing is foreign bodies or corneal abrasions. Sometimes if your child is out and it's a windy day and something blows into their eye, it may not be obvious to you, but all of a sudden you have a child who is acutely, very quickly irritable, rubbing their eyes, tearing like mad. And so I think if that happens, or if you see that something blows into their eye, or if they scratch their eye accidentally, or God forbid we do as a parent, which has been known to happen because it's an accident, those are reasons to get to your doctor as well, and they will do something called a fluorescein exam, which is putting a little drop of something in the eye that glows in the dark to see if there's any kind of corneal abrasion on the front of the eye. They may also turn the eyelid inside out to see if there's a little foreign body in there and try to irrigate the eye to see if the discomfort is alleviated. Because if foreign bodies are left in the eye, they actually can bury in deeper and cause some big, major problems down the line. So if your child acutely has eye complaints, get them to the doc right away.
Okay.
Preserving and maintaining the health of the senses is so important. And so just as with the eyes and vision being a very big priority with a child, the ears are also a big priority. And unfortunately, things like ear infections are a very common malady in childhood. There's no doubt about it. The drainage is lousy, the immune system is young, kids touch and feel everything in their universe, so they have proportionally more respiratory infections than any other being on the planet. So ear infections do and potentially can impact hearing either on a temporary basis during infection, but if there's chronic infections and scarring, that certainly can impact hearing and ultimately language development as well. So if you suspect that your child is not hearing well, no matter what, very important to get to your pediatrician and really articulate this concern emphatically. Because testing hearing in a baby now is easy to do. We have easy ways to do it. Most communities have more than one speech pathologist. There are ways to ascertain hearing that can really help preserve hearing or restore it if we intervene early. Now, if your child has ear infections, your pediatrician may opt not to treat them because we know scientifically now that antibiotics are not always the answer. Time and just natural drainage can take care. But if your child is acutely uncomfortable and continues to be so, and especially if they have systemic symptoms with their ear infection like fever, listlessness, vomiting, poor eating, those are reasons to get into your doctor and really have another discussion about whether antibiotics are necessary under those circumstances. Second of all, if you notice things coming out of your child's ear, like it looks like baby squash, that's pus coming out of your child's ear until proven otherwise. So why does pus come out? Sometimes when an eardrum ruptures during or after an infection, but sometimes if there's a foreign body in there. So if your child is constantly referencing their ear and really yanking at it even without a cold, go in and have it checked, because you never know if there's a little bead in there, a little eraser. I've seen airplane tires, you name it, we found it in ears. And if those things sit in there for too long, they can cause local swelling and marked difficulty in extracting them. And kids are just experimental beings. They just want to see what fits in every hole. So sometimes we have quite a surprise. So if a child is acting uncomfortable, definitely get them to the doctor, even without a fever. The last thing is earwax. Now, most parents are so afraid to clean ears because people like us say, don't get near your child with a 10-foot pole. Now, the ears actually have hairs in the canal that naturally move wax to the outside. So if wax is soft, that's an easy deal. But if wax dries out, if you live in an arid climate like in Arizona or here in Southern California where the air is very dry, and you don't let any liquid get into your child's ear, that earwax can turn to stone. And then it can start pulling on the ear hairs and cause difficulty and sometimes irritability in kids. So again, if your child is referencing the ear and all your doctor finds is stone hard earwax, then removal of that will alleviate your child's symptoms. So how do we get around that? Well, when you give your child a bath, let a little water get into their ears. The ears are like a little cul-de-sac. The canal literally has a blind ending and comes right back out. So if water comes in, it just drips right out or evaporates out, and it can lubricate that earwax and keep it moving in the right direction. Then when you see it at the outside of the ear, just snag it with a Q-tip or your finger or a tissue, and that way you can remove the kind of smelly old wax that's making its way to the outside. Now, the other thing that can happen is that cradle cap, again, it sounds like the bane of a child's existence, but it can kind of recur behind the ears, and that's called seborrheic dermatitis. What it looks like is greasy scale, much like the cradle cap your child might have had early on in infancy. But it causes cracking or fissuring behind the ears, and it can be very uncomfortable for a child. A lot of people will look at it and think it's actually an infection, when indeed it is not. It's just inflammation of the skin that often will just respond to a little topical steroids. So if you see splitting or cracking behind your child's ears, especially if there's greasy scale with it, try to gently remove the scale with some baby shampoo, try a little hydrocortisone cream on it, and if it doesn't resolve, then get your child to the doctor. But that's something that's often ignored, but it is a source of discomfort for a child, and very important to honor that discomfort and try to get them out of that.